In Chapter 1, we have a lot of background information about first aid and emergency care. It's very important to be able to understand what first aid is and why it's important for us. It's better to know first aid and never have to use it than to need first aid and not know what to do. So first aid providers are very helpful in getting to a scene, assessing it, assessing the injury, and being able to know whether or not they're able to help this person or if they have to call for medical help. They are not doctors, so they're not going to diagnose. There are injuries that sometimes are intentional and some of them are unintentional, but if not treated properly and not enough people know how to take care of this type of situation, it becomes a public health issue and ends up becoming an epidemic. You hear so many times about people that commit suicide or overdose victims, etc. So if you have some background in first aid, the more people that are trained in it can help people that cannot help themselves. There are different types of injuries that result in different types of actions that are needed. For example, injuries that are treated by first aid providers are usually, minor in the degree that they can handle them within their scope of practice. If they are more severe, then they need to be treated in an emergency room or physician's office. Sometimes injuries are so severe they require hospitalization for an extended period of time, and unfortunately the worst kind of injuries result in death. Every year, 1 in 4 people have some type of non-fatal injury, serious enough that they need medical care or they have to restrict their activity. So you see that in many sports-related industries. For example, I'm a certified tennis professional. For years, taught athletes and trained athletes to compete, and I saw so many injuries, whether they were ankle sprains or hamstring tears or rotator cuff tears. It went, around from so many different things. I even had one athlete that suffered from heat exhaustion. So being trained in CPR and first aid was very, very effective because I was able to help these people right away. The faster you get care, the better the treatment is going to be. So first aid responders are really great in assessing a situation and determining what type of care is needed. There are some times where death can occur. It's not, often. Most injuries, don't require life-saving efforts, but there are some times you can be with somebody who is having, symptoms or actually having a heart attack, and what you do as a bystander can be the difference between life and death. It's very important. There's a lot of value in first aid, even if you're not in the healthcare profession. So you're not an EMT, you're not a nurse, you're not a, doctor or whatever the situation is. You can really benefit from knowing first aid just because you can handle your own injuries. And if you are injured and you need to help somebody else, you know enough about what you can do to direct someone else to take care of the other person that's injured. So it really helps with, keeping you aware about safety and preventing injuries from occurring because of the knowledge you have. It's important because if you are trained in first aid, you can help your family, you can help coworkers, strangers, friends, anybody, and that gives you a sense of confidence. And sometimes if you're in a remote area, it might be that you're out hiking somewhere and somebody falls off a rock. It's great that you have that ability to be able to help them, even if there's an area where it's a disaster. There was like we had a horrible Hurricane Sandy years ago. It's good to be able to help people in those situations. The more people that are trained, the more people can have access to help. So when you're able to care for people with acute illness or injury, you got to remember that doesn't take the place of proper medical care. We have to understand that we have to practice within our scope of practice. So a first aid responder, a first aid provider has minimal background in medical care. So you only can don't be the hero and think, well, I'm a doctor, I can do all these different things. You can't. You can do what you're trained to do, and it does not take the place of medical care. So the first thing you want to think about, what are the goals in providing first aid? Obviously, the first one is to protect life. You want to relieve suffering, prevent further injury or illness, and promote recovery. There are certain things that as a first aid provider you need to show competency in. One is you have to be able to recognize, assess, and prioritize the need for first aid. So you get to a scene, you're able to recognize somebody's hurt, assess the situation. Is this something you can handle as a first aid responder? Or do you have to call 911 immediately and and step away from the situation because it's beyond your scope of practice? You have to prioritize the need. If there's multiple people that are hurt, or if there are multiple injuries, what is the most pressing issue and which is the most injured person that needs attention right away, kind of performing triage on the scene. You have to use your knowledge, skills, and behaviors that you were taught in first aid as a certified first aid responder, because if you don't, you go beyond the scope of practice, and that could further injure the patient. So you have to recognize your limitations and seek additional medical care when needed. So that concludes our first part of this chapter. The second part of the chapter will get into the legal issues with first aid and what we need to know with regard to from a legal standpoint.